On surgery day, I arrived in the morning and was greeted by Diana, one of Dr. Hamwi's nurses. She brought me back to what we like to call the ready room, which is kind of where we do the pre-op before surgery. She took my vitals, we went over instructions, I signed the consents, and then I changed before Dr. Hamwi came in to say good morning. My role in our practice does not incorporate a lot of pre or post-op appointments, so it was great to experience Florida plastic surgery from the other side. I feel like I'm now much better equipped to answer patient questions now that I've experienced it myself. The team I work with every day suddenly became my care team. It was comforting, but still real. The clinical team was really great about taking the time to explain the pre and post-op instructions and really what to expect from the patient standpoint as opposed to our clinical standpoint. Of course, at this point in the day, I became a little bit more nervous, but I knew I was in the best of hands and Dr. Hamwi would take great care of me.
So now I'm putting in the numbing medicine. How you doing?
That's great. This is it?
This is it. Yeah, you're doing amazing. So what we typically tell people is that on a scale of 1 to 10, we want to keep everything at a 3 or less. Annoying, but not the end of the world. Did you say that's where we're kind of at?
I'd say we're about a 1.
We're at a 1. I love that. All right, perfect. Well, we just finished the numbing portion, and a lot of people say that that's the worst part. How was it for you?
Everything was really great. There was a couple pinches in different areas, but they went away super quick, and Diana's tapping was great.
Oh, that's awesome. Yeah, the tapping actually makes a pretty big difference.
It really does.
All right. On a scale of 1 to 10, we say, gosh, we like to keep everything less than a 3 out of 10, like annoying, but not the end of the world. Was that sort of your experience?
I'd say it was even less than that. I know we say 3 a lot, even when I'm in surgery with you, but I'd say 1, maybe it hit a 2 at sometimes, but never worse than 3.
Right? I think how nervous people are affects their perception of what a pinch feels like. And so maybe because you've done this before and seen it, you don't seem particularly nervous. So we've done the numbing, now we're gonna do the liposuction. So just for a little bit of reference, I'm just gonna show real quick sort of how things look like after the liposuction. So we've made a tiny little poke right here. That's allowed us to put numbing medicine all through here. So there's really nothing too scary or graphic about the liposuction. It's really just not that intimidating for people either. So anyway, the next part of this is you're gonna feel some vibration. And then we're going to sort of shrink the arms in the areas that we're trying to get lifted. So anyway, great job, here we go. Numbing, then liposuction, and then we'll do the brachioplasty. So what we do now is just take a little break. I'm gonna let you go to the bathroom, give you a little snack. We'll tear everything down, reset up everything. Will you get a little break?
Perfect.
And then we're gonna knock this out, but you're doing pretty well, right?
It's so easy.
It's so easy. All right, well, you look great. I'm really excited for you.
Thank you.
All right. First of all, how are you doing?
Everything's going really well.
It's going great, awesome.
So
Yeah,
easy.
I love it. Put your arms out for me real quick. And so this step is where I kind of go through and I look for the geometry, the symmetry. I make sure that things are even and smooth in the way that I want them, that there's no significant irregularities, and it's looking just the way I want. Now, what I did notice is when you put your arms down, I see this. I see a little bit around your elbow that I didn't see when your arm was up. And so this is why I love doing this awake, because it allows me to kind of go in and I see nitpick. I love the precision that this gives me. I see a little bit thing right there, right? You see that too?
Yep.
Yeah, so we'll go back and now we'll polish over. And so it's a really great opportunity to get this just the way I want it. So, all right. Yeah, not as much down here, but maybe a tiny bit like that. All right. So what we've done is something called Tailor tacking. And this is where we clip the skin up to sort of show us what the final result will be like. This is another opportunity for us to check our work. So I really like the lift we've gotten here, but I noticed that there's still a little bit of extra skin here, and I don't love that shape. Now, this area in particular is something that we need to take a little extra care with, because you don't want so much tension, because you can have openings or you can have issues, but you also want really good shape. You want the arm to come in to the armpit, and you want it to stay nice and shapely all the way up into here. So in her case, I feel like I can get out a little bit more skin here and still get a good closure without compromising the safety of the procedure. So we're just gonna go back and I'm gonna sort of Tailor tack this area to get that to come up. So now what I've done is I've Tailor tacked up a little bit more skin. We're gonna take just a little bit more from there so this comes in and up. We get a little bit more of a shapely, a better overall geometry to the arm. So I like that even better. Good job. Just for reference, this is what the other arm looks like. This is what the new arm is gonna look like. This is part of what gets me really excited. This is the step where I start getting really, really excited. So anyway, yep, let's go. We're gonna do the same thing to the other side. We're all done. You did it. Congratulations. Well, I'm just gonna kind of show off your arm real quick. We've gotten rid of the stuff that kind of hangs. We've got really great arm shape. We've got this really nice incision that we're gonna cover up with a special dressing here in a second. But honestly, I couldn't be happier for you. Yes.
Thank you.
So you're welcome. You're welcome. Hang in there. How was it? You doing all right?
It was so easy.
Yeah.
I was falling asleep at one point.
Oh, Joe. Oh, I just couldn't be happier for you.
Thank you so much.
All right, we're gonna get that garment on.